Every Friday night at 8 p.m. for the next 6 weeks, we bring you these deep discussions and powerful presentations on health, migration, Brexit, entrepreneurship, and more to you right here on your favorite Unmute Now podcast channel. On today's episode, Dr. Daniel Gboloo-Teye unpacks the mental health needs that people who have recently migrated might have. He discusses factors affecting and barriers to good mental health, as well as steps towards improvement. Dr. Gboloo-Teye is the clinical director and a consultant psychiatrist for CAMHS, the Child and Adolescent Mental Health Service in the Belfast Trust. He is a member of the Association of Black Psychiatrists UK and a board member of Counselling All Nations, CAMHS. Dr. Dan, as he's affectionately known, certainly raises the volume on this whispered conversation. Go on, throw off the stigma, and enjoy.
I was asked to speak today, I'll contribute today regarding on the aspect of the mental health aspect of migrants in Northern Ireland in the levelling up agenda. When the topic was given, I was like, the mental health needs of migrants. Where do you even start? And how do you kind of approach such a subject? Because when I thought about the topic of the mental health needs of immigrants, I know immigrants are called by different names. You have, if you want to define them by race, by ethnicity, by any definition, you're going to have various permutation of names. In America, they call them aliens, and some call them foreigners. And the idea of a greenhouse came to my mind. And I was like, the needs of the immigrant population is very complicated. And therefore, think about a greenhouse. And to have a greenhouse means you have to create an environment where foreign plants or where plants are to grow, not within their own context, not within their own environment. So you have to create a greenhouse, and in that greenhouse you have to provide the appropriate environment in terms of water, the air, the humidity, the level of heat that the plants need to grow. And so when I thought about the greenhouse, I was like, right, okay. That is the idea that came to my mind when I thought about the needs and how we can work towards improving it. You can look at improving the needs in various ways. You can look at it from the point of the immigrant, that you have to do something to improve your own lot or your own welfare. But if you look at the greenhouse, for the plants to grow, it is the gardener that tenders for that plant. It is a gardener that provides the environment. It is a gardener that waters that environment. Because the moment that plant is taken out of the greenhouse into the general environment, it's going to wither. It's going to die. And that was the image I want to leave with you as we talk about the needs. And as we go through it, we will all come to appreciate that the needs are so complex, but the environment to meet those needs have to be worked on. And that is kind of the image I want to leave with you as we go through this discussion. So for the objective of today, what I'm going to do is to look at the migrant population. Who are the migrant population? And then we'll look at the broad range of needs that we have. We want to look at the health needs, and we're going to focus on the mental health needs. We're going to look at the factors that affect the mental health of migrants. Then we'll look at the barriers to mental health. And then we will focus on how do we begin to address these barriers towards improvement. And then I will leave you with some useful resources that you can fall onto when you want to assess mental health needs or some mental health aspects of our population or our group. In terms of the who and the what, as I said, the migrant community, we call the migrant community, some call them aliens, some call them foreigners. And until recently, we have what we call the BAME group, which is the Black African minority ethnic grouping until recently. I understand this term has now become quite a political term. But until recently, where we used to classify migrants as usually Black and Asian minority groupings, you can see that that has changed quite considerably. With the war in Europe now, migrants are not just Black and Asians, but we have the migration from Ukraine within our midst. And that is very interesting because the needs, you can see, no longer depends on the color of your skin, but it's about your identity within that population or within that groupings. And therefore, when we talk about the needs, it's important to kind of go beyond skin color to looking at who the people are and what they are being exposed to by virtue of being either voluntarily taken out of the environment or they have been forced to move to a different culture or to a different environment. And in terms of the variety of presentation, you have various groupings. So it's almost impossible to talk about the needs or the mental health needs. Because let's talk about new immigrants, those who have just arrived. What do you think their mental health needs will be? Those who have lived here for so long. Those who are between a year or two in their migration in their migration time zone. So in terms of needs, the new people, the long stay, the recent arrivals have various needs. Then if you look at the needs also, variety of cultures, religious beliefs, hopes, dreams, aspirations. So you can see that trying to create a unified front or unified atmosphere to understand the needs of these of migrants is an impossible task because you have various levels and various layers of needs within that population group. But there are some commonalities as we go on. We will be looking at those commonalities. Three broad groupings that I think fit into the pattern of migration. Those who are here for economic reasons, they voluntarily left their homeland or their cultures and moved to improve their own lot and their own betterment. And then we have those who are fleeing war, famine, persecution. And in Northern Ireland lately, we have huge arrivals or large number of arrivals of people who are refugees or asylum seekers within our cultures now. I've lived here for very long. And when I came in here earlier on in the late 90s or towards just at the tail end of the 20th century, you could walk the length and breadth of Belfast and not meet any black person. So we were like celebrities. I was like, great, this feels good. This is, so wherever you go, somebody gives you a high five, and, it felt really good. And I was like, yeah, it's great to be a celebrity. Who doesn't want to be a celebrity? We all want it, So economic migration, and then we have, but lately we have so many minorities. In terms of percentages, it's hundreds of times multiplied from what it was in 2011 when the last census was taken about migration in this region. And then also we have the students population. And you can see that the needs or the mental health needs of this group will be quite different or varied, and will have many levels or layers of complexity to it. So the main thing is that the needs are very many, or myriads of needs. It's important to, when we're talking about needs, to understand or to link it to the Maslow's hierarchy of needs. In terms of the Maslow's hierarchy of needs, we have the basic needs, and we have, need for what we call the physiological needs, the safety needs, love and belonging, self-esteem, and self-actualization. The bulk of migrants, the needs will fall within the lower levels of needs within the Maslow's hierarchy. The whole mindset and what they need is a need for shelter, for clothing, for warmth, for call it a basic need. And those are food, shelter, sleep, clothing, need to reproduce. And you can see that as you go up, migrants also need for security. They need employment. Health needs are within that hierarchy. And by the time you talk about the need for respect and self-esteem, where the migrants feel settled and they now are beginning to contribute to the society where they have moved into, you can see that it takes quite a while. And therefore, if you come in here as an asylum seeker or as a refugee, the bulk of your initial preoccupation will be how to survive. And that comes with it various layers of stresses, which we're going to touch on as we go. So in terms of the health needs, two broad categories. We have the physical health needs, we have the mental health or mental or emotional, health needs. I'm now going to look at, mainly my task for today is to look at the mental and emotional well-being or health needs of migrants. Mental illnesses are many and varied. The common ones we all know of are the anxiety disorders, depression, psychotic disorder, post-traumatic stress disorders. What is important to note is that the rates of all mental illnesses in migrants, comparatively by research and by presentation, is higher than the local population. And we'll come to know or see the reason why this is so. The link with, psychosocial stresses that they're exposed to, the need to adjust into their environment, and then just in terms of the general migration, mental health needs are higher. But when it comes to those who are fleeing war, persecution, famine, the rates of mental health presentation within this group is even many-fold higher than the general, let's say, the economic migrant group. And that takes us to what health is. If you take, to understand the needs, it's important to understand health as a whole. And the WHO, defined health as a state of complete physical, mental, social well-being, and not merely the absence of disease or infirmity. That is the WHO definition. So you can see that right away, all of us here are mentally unwell. Because there is nobody who can claim that I have a complete state of physical, mental, social well-being. No. We all have various levels of stresses and difficulties as we go, or in our lives. And then if you take, as I said, the mental health, the WHO sees mental health as a complete state of social, physical, and emotional, well-being. But if you take mental health, it conceptualizes mental health as a state of well-being in which the individual realizes his or her own abilities, can cope with the normal stress of life, can work productively and fruitful. So this is perfect mental health, and is able to make contribution to his or her community. And that takes the next level. So to say you are of complete mental and emotional health, well, this is what you need to, the criteria that you need to satisfy. Next slide. Then the NHS, similar definition. It is a state of positive state of mind and body, feeling safe and able to cope with a sense of connection with people, communities, and wider environment. There are certain terms which have been thrown in here which are so important in helping us to identify or define what the needs are. So feeling safe, being able to cope, connection with other people, and to the wider community. You can see that immigrants, by virtue of not being within their own natural environment, have a breakdown or a breakup of all of these connections. Their own, social systems and norms have been completely disrupted by virtue of them moving away from their own local environments. So, we talk about the mental and emotional well-being as defined below. So if you take physical, social, so psychological and social, you can see how all these factors are so closely intertwined. Let's take physical health needs. In my culture, they say a hungry man is an angry man. Okay, so just by being hungry, you are emotionally unstable, and therefore you are tendency to argue. You can see that the hungry man might be coming from a social system where might be struggling to have proper shelter and accommodation. This week or last week, I met a family, a young patient of mine who came from somewhere into Northern Ireland. Initially, the dad came in here first, was given a singles accommodation where he lives, and then past few months, the family joined. That's a wife and 2 children joined him, and then when they came, they were still living in that single person's accommodation. Straight away, you can see where the stresses of just the accommodation, shelter, has become an issue for this family, and how that is going to begin to impact on the emotional well-being. This child is developing significant emotional difficulties, which we are now working through, to deal with. So it's important to know how closely intertwined all these factors are in talking about mental health needs. Next slide. So what are the factors that affect the mental health needs? Already you can see where the biological, the social, the physical environment are one of the key underlying factors that affect our mental health needs. On top of that, the key factors that we're going to look at, which are closely interconnected, is the nature versus the nurture. The nature, which is your own genetic disposition, where what your genes are saying. So some people will have higher resilience to developing mental health. In some families, there is a genetic loading of developing mental health, and therefore for all the people that we are talking about, you can imagine where your nature already primes you up at a higher level, and then the nature, which is the environment, which becomes inconducive. Think about the greenhouse, tips you over the edge, and then you develop, significant mental health problems. Physical factors, psychosocial stresses, socioeconomic inequalities are all hugely important. Other factors which affect the mental health of migrants is the issue of access to health. And the issue of access to health is linked to, oftentimes, the lack and knowledge of awareness of what is out there. How do I even assess it? How can I, who do I need to speak to, to help me be able to identify or know what my needs are or what my problems are to help me resolve them. The issue of racism and discrimination are hugely important, and these can be either subtle or it can be very overt. We know that we think that racism has no stake to play when it comes to these things. But if you take the emotional well-being, the stability of mind, the peace, Maslow's need for safety, comfort, love, acceptance, you can see where somebody feels discriminated, straight away it goes to impact on their mental health, of that individual. And then stigma is another significant factor. Now, stigma is, let me try and explain stigma to you in my own local setting. I'm from Ghana originally, and in my culture, they said anybody who has been mentally unwell before, there is always something there. Yes. So no matter how much you have been treated, cured, people always look at you with suspicion. That is back home. This is the simple explanation of what stigma is, and that is still very relevant within this culture, where the mentally unwell are perceived as, being not part or don't belong to the fullness of society, and therefore the tendency for people who have mental illness to withdraw from society becomes, very, very high. And so and then that also goes on to impact on the person's self-perception and how they view themselves. And therefore, if I feel not accepted, I'll rather keep myself away rather than seek help when I need it. So stigma is hugely important. It's important to understand the role of trauma in the mental health presentation of immigrants. For those who are economic migrants, might have had stable moves and, calm movements to this environment. And therefore, we can say that they haven't been exposed to that acute, severe trauma. But imagine those who are fleeing famine, war, and persecution, who have been exposed to huge amount of traumatic events. They go on to develop what we call the post-traumatic stress presentation. And chronic exposure to trauma has both immediate and long-term impact on the emotional well-being of an individual. And especially when it comes to women and children, which is my area of specialty, this is so important. What we know is that imagine a woman who is pregnant, who has to flee from their home, and who has to come and settle outside their immediate environment. Now, what we know in mental health or in psychiatry is that exposure to trauma starts in utero. There are various neurobiological chemicals that are stimulated when people are going through traumatic life events. We call them the stress chemicals. And while the baby is in the womb, the chemicals that are, acting within the womb environment start impacting on that developing child. So you can see that child then is born, and then the immediate environment is unsettled. That trauma then continues, and then that child becomes primed up into developing long-term emotional difficulties, down the line. And therefore, the needs of women and children is so important. And oftentimes we talk about what we call transgenerational trauma, where that trauma, because people have been primed within the womb, that trauma is then passed on from generation to generation. In my own world where I practice, you can see young people presenting with significant mental health problems. You can trace their problems to the immediate generation and to the next and to the next and to the next. And therefore, transgenerationally, people are impacted by what they have been exposed to. So trauma is hugely important. Helps us to understand why we need to kind of create an environment that will take care of the needs of of migrants into our system. So then that goes us to we ask the question, what are the barriers to health as a whole? In terms of the barriers to mental health, even though we all have the same rights under law, there are many barriers to people of the migrant community accessing health, both physical and then emotional. And we can group these barriers into two broad groupings. Those which are inherent within the minority group themselves, which we call the internal factors or internal barriers, and then those that are outside, that is the environmental factors, which kind of is very broad, spans from your immediate place of residence into your immediate community, into the district that you live, and then nationally, so you can expand it as you go. So let's look at some of these internal barriers. One, the immigrants, by virtue of our cultures, sometimes, and then by definition of what mental illness is, or the various mental illnesses that we psychiatrists see, sometimes they fail to recognize that I'm developing a mental illness. So that is barrier number one within a person. And the definition of mental illnesses within developed cultures can be quite different. Over here, we use a criteria for diagnosis, which we call the ICD-10. ICD-10 is a system of classification of diseases where people have to meet certain criteria to say you now have a depressive illness, or you have anxiety illness, or you have a psychotic presentation. Okay. The cultures where these people are coming from, they don't have ICD-10. And sometimes the presentation of illness can be slightly different from the understanding of the Western, understanding of what these illnesses are. Then the issue of language barrier, where how do I explain that burning sensation in my head is being caused by, I think it's being caused by my ancestral spirit following me, or being bewitched and somebody out to kill me. How do I explain that to a Western psychiatrist? That is an impossible situation. So straight away, the language even to understand and the cultural context of these things are very different. And then once you are even able to explain, even to get an interpreter, sometimes we use interpreters. So language, it becomes a huge barrier in preventing access or free access to health. And then frequently what immigrants do is, because of some of these barriers, we turn to our family and friends, who then also give us the wrong idea. Yeah, no, this one, you don't need to tell anybody about this. Just keep it to yourself. The moment you start saying this thing, you're going to lose your benefit. You're going to do this, and therefore they withdraw, and then they keep themselves to themselves. So turn to families instead of seeking professional help is another barrier that we commonly encounter in our work with families and people. Internal barriers, socioeconomic barriers. Deprived communities usually, lack the financial means to access these situations or to access mental health freely. We know even within the local community, mental health needs are far, far higher in the deprived communities. There was years ago, we know that when you take, part of West Belfast, there were huge spates of suicides in young people within that community. And the rate of presentation of mental illnesses are much higher in deprived communities. This is within the local community. So think of that and multiply that by many folds of people who don't naturally come from here, who are more psychosocially more deprived than the local community, and then multiply that by a certain factor to see how much socioeconomic factors impact on the mental health. Sometimes people who, the migrant community don't feel listened to. or understood by healthcare professionals, and language becomes an issue also there. And then one big factor is that services are usually not tailored to the needs of migrants. I'll give you an example. Recently, we talk about the trauma network, which has been established recently, government approach to look at trauma and treatment of trauma and, transgenerational trauma. But at the start, it was only meant to be focusing on the trauma of the troubles. So people who have been exposed to trauma of the troubles in Northern Ireland were who this is meant for. As things develop, we got, through discussion, it was agreed that, right, migrants also have trauma, so why would you want to limit it to just the local community? It needs to be broadened to, to help everybody who's been exposed to trauma. Apparently, tail end of it during its establishment is gone back to trauma of the troubles alone. And you can see where is the justice in this? Where is the needs of the migrant community? Those the people from Ukraine who have been exposed to huge amount of traumatic events. How do they access this service? We are saying, no, you can't come and access this because your trauma is different from the trauma of the local people. So these are some of the huge internal barriers also. So services not tailored to their needs. And then the negative perception and social stigma, as we mentioned earlier on. Then we come to the next big barrier. And the next big barrier is barrier in getting help, which are the external factors. Stigma of mental health is back in here again. So you can see that stigma is both, it's a double, edged coin, or it's a double-sided coin. Then included the impact of long waiting times. If you take my service, for example, there are huge long waiting times. If you get a new referral into the system, okay, you have to wait weeks, not months, sometimes 6, 7, 8 months for a new referral, to be processed or to see a mental health practitioner to, for your needs to be taken care of. So that is part of the internal, barriers to accessing help. So imagine the immigrant coming from, the immigrant's needs, who first and foremost has to battle through the bottleneck of even being able to access that help. And then once they make the referral, they have to wait for so long. Meanwhile, whilst waiting, the problems get exacerbated. Language barrier we've mentioned, the issue of poor communication between service users and the providers, inadequate recognition or response to mental health needs, then imbalance of power and authority between service users and providers, and let me say this is inherent within the normal service delivery and provision for the local population. And therefore, when it comes to immigrants, you can see that this is multiplied many times over. Then cultural naivety. People think, these people, they don't understand the cultural context of the presentation. So they interpret mental illnesses within the context of their own understanding. And therefore we move into the realm of what we call transcultural psychiatry, where, discussion ongoing to ensure that the system gets trained to be able to appreciate and understand the mental health needs of people. Then there's discrimination towards the need of the BME group. And then frequently the lack of awareness of the different services among service users, and providers, that people just don't know what the needs are. It's important to know that, let's ask ourselves, what are the things that maintain these barriers? We've talked about some of them, but to kind of highlight a bit on these barriers are maintained by certain values and mindset, which also works in both ways. We have mindset within the immigrant population, and then we have mindset in the local community and right higher up, into people who commission services. So the first one within the immigrant group is the issue of self-perception. Sometimes immigrant group grows, we perceive ourselves differently. We think we don't deserve it. We think we are not worthy of the service. We think I have to cope with this a little bit more. We think just be strong, just don't go forward. So that is a mindset that can, or goes on to maintain these barriers. I like this thing about as a man thinketh in his heart, so is he. Sometimes we have this negative perception of ourselves. I think to be able to work or to move things on, it's important to right away begin to educate people that you matter, your rights are the same as the local population, that you going forward, you're not going to be discriminated against, even though there is inherent discrimination. It's about educating people and working with them to appreciate that you need to change some of those mindsets. Oftentimes we stick to our own common zones and people kind of just cluster together. There are many complex layers of this. Yes, if you have arrived and you have been put in that corner, that is what you know, and therefore you stick to that zone. And oftentimes the cultural beliefs within that setting then goes on to fuel this negative perception. Oftentimes, the issue of assimilation and integration, it takes a very long time to assimilate and to integrate. I have lived here for so many years, but it took me the first few years when I came in here. Initially, I thought people were just being nasty when you talk to them and they say, "Pardon me." I thought I'm a Ghanaian. The colonialists gave us the English language, and I think I started studying English from kindergarten right through to university, and therefore I speak some good English. So you should understand me. So the issue of assimilation, it took me so long to, it's years down the line that I realized, yes, the accent, the way I speak, the way I pronounce my words. Here, if you want to call somebody's name, like anytime I call my name Daniel, they say Danielle. I said, no, it's the male, the man Danielle. So language barriers and assimilation took so long. And I have this funny story to tell, that my own way of getting around it initially was this. I know that whenever I go into a shop or a place and I speak the first word, person will say, "Pardon me, sorry." So what I do is, the first word that I speak is some Ghanaian language word. It's some Ghanaian language word. So when you say "pardon me," I know you didn't understand me. And that is my own funny ways of getting around some of these things. And then once I've got your attention, then I'll take my time to kind of gently and nicely speak my Queen's English for you to get me. So you can see that this mindset in issues of assimilation, and then is so important. Then within our own communities, one of the big things that we face with is the issue of inter-minority discrimination. As migrants, frequent and oftentimes we kind of discriminate against each other. We don't reach out to our own people. We don't easily, integrate within our own communities. And therefore, if you are not united and relating to your own people in a unified way, you can see how easily you can become a target for other people. So the issue of inter-minority discrimination is hugely important. And as we discuss and think about accessing help and mental health, all of these things do have an impact on the mental health of people, of our people. In the local communities, we have various stereotypical perceptions and ideas within the local community. Migrants are generally seen as people who are here for the sake of benefits, scroungers. They are aggressive, they are criminals, they are violent, they are non-deserving people, so why do we care about them? Why should we care about them? Or and the way services are designed and commissioned, as I gave you that example earlier on, is another key example. The needs are not at the forefront of local or national government. So even though we have the statistics and awareness that these are issues, these are not at the forefront of our service providers. And I give you the example of a trauma network. So I'll be finishing soon. So how can these needs be addressed? We've seen, the need, the mental emotional health need. We've seen what the barriers are. We've seen what the difficulties are. How can we begin to work towards addressing this? My topic for today is not to come and talk about mental illnesses. That would take us a whole day. So I'm not focusing on what an illness is and how to treat it. It's looking at the bigger picture and how we can help our people to access help, to be able to break down some of these barriers, to be able to understand what their needs are, and how we can support the system to improving towards meeting the needs of our people. So how can these things be addressed? At the local and national levels, and also at the governmental levels, is where these things need to be addressed. That takes us back to our greenhouse. Our greenhouse imagery that I gave you earlier on. It is the farmer of the greenhouse that needs to create the harmonious environment to helping that plant to flourish and to grow. And if the farmer or the gardener is failing to provide the conducive environment, you can see how that plant is going to be impaired, or is going to wilder and is going to die. And that is a key message I want to leave with you. So we want to look at what are the regulatory frameworks and policies that need to change. And as we go on, these are things we want to focus on. Minorities will require considerable mental health literacy. People are coming from their own cultures, language differences, different understanding of mental illnesses and mental health. And as they come into this environment, we need to create the space to help them to appreciate in small groups, through their community leaders, to create the system that will help them to understand mental health, difficulties. And literacy is key in this. We need practical support that is going to raise awareness of mental health conditions and how we can combat stigma within the system that we live in. There is a need for improving information about services and access, and then various pathways that we need. And so hopefully at the end of my discussion, I have a few slides that will give you some pointers to some of the services that are out there. And then community cohesion is hugely important. Let's work with our people to become a cohesive community, and then help them to reach out to the local communities in terms of accessing help, because these are people who know the system better. Let's make connections with the local communities as we try to integrate and assimilate into the system. We need to improve understanding of mental health conditions and access, a need for relevant training and support in engaging and management of various mental illnesses, the need to develop effective communication strategies. So providers, let us get ourselves trained properly to be able to communicate appropriately to migrants who are presented with mental health conditions. Then inclusion of minorities in the development and delivery of culturally appropriate mental health services. You cannot, come and design a service and impose it on the people. If you want to provide the appropriate help, get in there with them, learn the language, understand their needs, and then the services they have to help the system to develop that service. And that is one of the ways that service will then be able to focus on their needs specifically. So that brings us to the main focus of discussion. And I have some resource materials here. These are really, really useful resources, which gives various mental health conditions and how to access help and all the various presentation. I really want to recommend this to all of you. And I belong to an organization called CAMHS, which is Counseling All Nations. It is a BIM mental health counseling organization, and I'm on the board of that organization, and we provide counseling and mental health and emotional support and treatment for Black and ethnic minorities. We don't discriminate against the local communities. We have, people coming to us also. We work through interpreters and other people to help people presenting or migrants presenting with mental health difficulties. And these are a few references that you might want to refer to, which also have useful resources or materials within them. And therefore, I'm going to pause for any questions. I think I have done justice to my 1 hour. So I'm going to stop here.